In this Mental Health Awareness Month, we invited a few of our guests from the SOS Show podcast to share about mental health awareness, and this is what they had to say.
Hello, my name is Parveen, Shaikh. I'm a psychologist by profession and I work as the Vice President at Mpower, which is a mental health initiative of the Aditya Birla Education Trust. So, the significance of Mental Health Awareness Month. So, as a psychologist, as a mental health professional, I'll be very biased towards it. So, for me, it's significant every single day, every single moment. But why this month is significant? Firstly, let's understand mental health. Mental health, WHO defines as there is no health without mental health. So it becomes an integral part of our growth, our well-being. Okay. Secondly, mental health is a human right now as per WHO. These are the reasons why it becomes so integral part of our life. Secondly, the existence of mental health issues. In our country itself, 1 in 7 people have gone through a mental health problem. I don't say it, a research in 2017 says it. It must have grown much higher than that right now. Secondly, out of that percentage, 70 to 90% people don't even get diagnosed and they just live with the problem. And lastly, mental health will cause our country, as per the research, a loss of $1.03 trillion. So all these things make it very important to talk about mental health and spread the right message, not only across a month, but across the whole year. So Empower's vision is a world where anybody going through a mental health problem lives stigma-free, lives with respect and dignity, irrespective of age, gender, economic strata. And we want to do that through spreading awareness, giving the right services, doing counseling, going to the communities, with advocacy, outreach work. Now we do it across the year, but especially during the Mental Health Awareness Month, because it's the awareness month, what we are trying to do is push out data, push out information on mental health at various stages. Unlike other illnesses like a diabetes or a blood pressure, which may hit a person later in their life, mental health can affect you as early as a child. Even when you are in vitro, like when a mother is going through pregnancy, she can go through depression or postpartum. So we are, sending out messages and information on mental health across various stages of life and spreading out across all our channels so people can access it. Making our professionals talk about it in our live sessions, giving data on all these stages where they can understand at what stage, at what age, what happens in terms of mental health, how could you prevent it actually more than, intervention, more prevention. So people are aware, they are more, at guard to see, okay, this is happening to me so I can take help from it. So we are just spreading awareness at various stages of a human cycle in this month. So why do we need to spread awareness far and wide? Of course, as I said earlier also, mental health is not about intervention, it is about prevention. It is not about a later health problem. It is a problem as early as a 5-year-old child or a mother who's pregnant. She can go through a mental health problem. So it's right there from the start of your life to the end of your life. It can go unnoticed because the symptoms are not like any other physical health symptoms. So it's really important that this message has to go far and wide because the effect is across the lifespan of a person. Secondly, the effects of it. So for example, the suicide rate in Indian women is double the global average. So we have to address special groups. We are a youngest country, one of the young countries. We have more youth, and India is having almost 2 lakh plus suicides every year. That's a great high number, and mostly in youth. So can you imagine the kind of loss we are going through because of the youth going through a mental health issue? Corporate world, India is growing, economy is growing. The corporate world research which Mpower did, what we found out was 48% of corporate world thinks that they are at risk of a mental health problem. Now, if we do not spread it far and wide, can you imagine what will happen if people don't know what is mental health and what can be done to prevent it? So that's why it's important to spread far and wide. Most difficult taboo or problem we are addressing, according to me, as what I see as a professional for 25 plus years, it's stigma, it's misconceptions, and it's accessibility. These are 3 big problems, I believe, in mental health. Stigma, because we just do not want to accept that there's a mental health issue. People have the hero syndrome, that, I will take it through. I will take it, and they don't say about what they are going through. So that kind of stigma, and if we have mental health, the kind of language we use, pagal hai, the kind of lay language we use, where people are just ridiculed for their mental health problems. That causes the stigma. People think if I tell about my mental health problem, if I say, I can say I'm having fever, but if I say I have depression, I'll be judged as a weak person, and that doesn't work. The misconceptions, like, go for a walk, do yoga, or eat mindfully, or do some mindful. Yeah, these things help, but they are not a fix for a mental health problem. So there are a lot of misconceptions. Talk to a friend. You have to talk to a professional. So these misconceptions add to the problems of people not being aware of mental health or seeking help. And lastly, accessibility. The world average is six psychiatrists in 1 lakh population. We have 0.75 and 0.07 psychologists. Can you imagine the lack of manpower? So with all this, obviously, it becomes very important to address it, and these are the problems we are facing, and we hope to deal with it. So at Mpower, we are doing our bit to spread awareness about mental health through our various initiatives. If you want to help, just start a proactive dialogue about mental health, and that will be good. And if you find somebody who is going through a mental health issue, or if you personally feel you want to talk to somebody, feel free to call a toll-free number, the Mpower Mental Health Crisis Helpline, and you can call and speak to a psychologist who will help you. The number is 1800-120-820050. Thank you.
Hi, I'm Neha Kirpal. I'm the co-founder of Amaha. For me personally, as also for our organization, this month holds a tremendous amount of significance. It's really important for people across communities, across sectors to recognize that mental health belongs to everyone. Mental illness might be a 1 in 4 problem. And therefore, for all of us to support those who are struggling, perhaps in some phase of their life or having an episodic challenge, by making tools and services available, by reaching out with therapy support and counseling support, as we do at Amaha, but also for people to support each other in communities. Across the board, I feel like it's really important for us to find a moment in time to recognize how important our mental health is, how the impact of mental health on our physical health as well, on our relationships, on our jobs and vocations, as well as the overall richness and fulfillment of life. For May, as the Mental Health Awareness Month, Amaha has identified various priorities for us to reach out to communities, to caregivers, to people with lived experience, as well as practitioners across different healthcare professions. So to begin with, we are doing a host of training programs for general physicians, gynecologists, and doctors across the board, so that they are able to identify early what mental health challenges people might face, and they're able to support them more appropriately, or also guide them to a dedicated mental health service. So besides professional training courses, we are also focused in a big way on the youth, and together with Youth Ki Awaaz, we are bringing out a report on how young India is facing access problems when it comes to mental health services, and what can we do as an organization to help bridge that. And it's something that is a reflective learning for us, that we hope to build services and offerings around. We're also doing work with Youth for Mental Health across college campuses in India to be able to reach out to young people and build awareness around this. Amaha has always believed that working with caregiver communities is a big focus for us, and so reaching out and doing events, doing talks and webinars with people directly living with mental health conditions is a big part of our May priorities as well. When it comes to mental health awareness, there is such a dire need for people to understand mental health belongs to everyone. Mental illness might be a 1 in 4 problem. And therefore, every month throughout the year, not just the month of May, must be a priority to be able to reach out to people with a message to support them if they are having a challenge, whether it's at a workplace or in a school or college environment, supporting parents, supporting employers. These are important messages to carry out, as also to make sure that people can provide the right care and treatment that is needed and have access to that. At Amaha, it's been a big priority for us to be able to reach out to as many as possible. Today, our therapy and psychiatry services are available in 600 cities and over 16 languages. And the idea really is to be able to get people to access help at the earliest that they have a need. So for us, throughout the year, this has been a big sort of priority. And I would personally urge everyone to make mental health a core part of their monthly messaging and conversations, no matter what the setting they might find themselves in, whether it's a work setting or a personal family setting or a social community-based setting. It's always the right time to have a conversation around mental health. At Amaha, we recognize that while a lot of people have normalized talking about mental health, when it comes to mild challenges, it could be anxiety or depressive challenges or perhaps certain relationship difficulties. But we must recognize that there are complexities and nuances around each of these, as also for severe mental health conditions. One of the big priorities for us at Amaha is to really recognize that there are people who are living with chronic mental health conditions that are perhaps lifelong, and they need a whole host of interventions, treatment, care and support that are helpful in their conditions. People living with schizophrenia, with bipolar, psychotic disorders, suicidal tendencies, and really struggling and needing a whole biopsychosocial support to get better. So for us, it's really important to be able to work with that end of the acutest, most critical need for mental health, and to be able to help people navigate their journey of going through the diagnosis and treatment and understanding what the condition is, to also a path to not just rehabilitation and recovery, but in a lasting way, so that they can truly integrate back into their communities and in the workforce and have a fulfilled whole life.
Hi, I'm Kartik, the founder of Driveway Devi Mental Wellness Initiatives. Mental Health Awareness Month forces us and compels us to look at mental health from all perspectives even deeper. For example, just the other day, to mark the beginning of this month, we had an interaction with an architect to examine how our spaces and wellness are interconnected. In addition to our ongoing programs that we do, during this particular month, we hope to have even more interaction with various experts examining mental health and its many nuances even more deeply. While there are many strides being made and many inroads as far as mental health in India is concerned, we feel that there's still a long way to go because there continues to be stigma and taboo attached with it. And therefore, a month like this is very significant, but we have to have sustained efforts and campaigns throughout the year. I feel the trickiest problem and barrier to accessing good mental health in India continues to be the lack of an environment or an atmosphere that encourages individuals and people to speak openly about their mental health issues. So I think that's what we need to tackle very, very strongly.
Hello, today I'm going to talk about a very important aspect of mental health, that is mental health awareness, which forms an important component of mental health. Because unless and until we are not aware of mental health issues, we won't be able to understand and recognize them. So as we see from the society's perspective, if we don't know what mental health is, what are the mental health symptoms, what a mental health issue can present as, we won't be able to understand it in a person who is facing it. Also, at the same time, if a person is or an individual is having mental health issues, he should know what actually the symptoms are. Unless and until we don't understand the symptoms of mental health, we won't be able to understand what is happening with us. Most of the times we ignore these symptoms because of lack of understanding, lack of information, or lack of resources available to us, or because of an important aspect that stops us from communicating these things is stigma. So significance of this month is, or awareness of mental health, is to promote equal understanding of mental health issues among professionals who are working around us, who are society that is around us, or the individuals who themselves are facing mental health issues. Also, it's very important to realize that if we are having a mental health issue, it's very important to report it early. Unless and until we don't report it early, the treatment for it or the intervention becomes very difficult, as it is a protocol for each and every health issue as well as mental health issue. Early identification and early diagnosis and early treatment leads to productive outcome and early recovery. Well, as coming to our part of place, like how we are going to promote this mental health, we already are running telemental health services, that is 24/7. Which is absolutely free. It's a national telemental health program that's going on by the name of Telemanas. It has been launched in all of the states, and in our state, or in my state, it's working 24/7. While we address the issues of people, we deal with all the type of mental health issues, be it counseling, be it treatment part. And most important thing is it's confidential, it's safe, and there is no stigma around it, because we can dial it from our homes, we can dial it from any of the places that we are in. Also, we are planning to promote our activities or start the awareness campaigns this month in our schools, because nowadays there is a lot of stress revolving around our academic zone. So our focus is both on teachers as well as students, how to promote their mental health and how to identify the mental health issues at schools, as well as the students who are in those schools, as well as the teachers who are working in those schools, how they can deal with their mental health issues. Also, along with this, it's very important to understand that a stigma that revolves around mental health is very significant barrier for mental health working or professionals, because in our society, people view mental health as a different thing. Because of this, people underreport their issues and they fear of coming to mental health professionals or seek the help. Also, it's very important to understand that we need to make the mental health facilities easily available. They should be easily accessible, and that should be affordable to all. That's why we are working here in Kashmir at the Telemanas, which is the telemental health services. That is 24/7 and that runs free, that's confidential, that is easily available and accessible any time of the day and to any of the individual in the society that needs or seeks help regarding their mental health issues. So I would like to inform all of you through this media or medium that we should never hesitate to report our mental health issue, even if it is like we feel that it's not significant enough. But it's very important to understand that early identification and early diagnosis will lead to a complete recovery. I wish you a very happy life and happy days. Thank you.
So, what are your thoughts on mental health awareness? Do share it in the comments below.